Does your family live in one of these states? Do you use one of these? Does your family use one of these? If so, are you aware of these? 6 new infections in the U.S. have been associated with using water from local municipal water systems to swim or use a slip and slide, immerse your head in a bathtub, mix solutions for nasal irrigation using a neti pot, or perform ritual nasal rinsing or ablution. In the last 10 years, 2005 to 2014, 35 infections were reported in the United States. Of those cases, 31 people were infected by contaminated recreational water. 3 people were infected after performing nasal flushing using contaminated tap water. 1 person was infected by contaminated tap water used on a backyard slip and slide. In Minnesota, there have been 2 confirmed cases, both children. Primary amoebic meningoencephalitis deaths associated with sinus irrigation using contaminated tap water. The National Center for Emerging and Zoonotic Infectious Diseases, the National Center for Immunization and Respiratory Diseases, the Center for Global Health, Centers for Disease Control and Prevention, Atlanta, Georgia, the Louisiana Department of Health and Hospitals, Ochsner Health Systems, New Orleans Department of Pathology, the Louisiana State University Health Science Center, Shreveport, and the DeSoto Parish Coroner, Mansfield, Louisiana. These prestigious institutions undertook a study of this deadly infection. The study background. Nigeria fowleri is a climate-sensitive thermophilic amoeba found in the environment, including warm freshwater lakes and rivers. Primary amoebic meningoencephalitis, PAM, which is almost universally fatal, occurs when N. fowleri containing water enters the nose, typically during swimming, and N. fowleri migrates to the brain via the olfactory nerve. In 2011, 2 adults died in Louisiana hospitals of infectious meningoencephalitis after brief illnesses. The study methods, clinical and environmental testing, and case investigations were initiated to determine the cause of death and to identify exposures. The study results. Both patients had diagnoses of PAM. Their only reported water exposures were tap water used for household activities, including regular sinus irrigation with neti pots. Water samples, tap swab samples, and neti pots were collected from both households and tested. N. fowleri was identified in water samples from both homes. The study conclusions. These are the first reported PAM cases in the United States associated with the presence of N. fowleri in household plumbing served by treated municipal water supplies, and the first reports of PAM potentially associated with the use of nasal irrigation devices. These cases occurred in the context of an expanding geographic range for PAM beyond southern tier states, with recent case reports from Minnesota, Kansas, and Virginia. These infections introduce an additional consideration for physicians recommending nasal irrigation and demonstrate the importance of using an appropriate water, distilled, bottled, filtered, for nasal irrigation. Furthermore, the changing epidemiology of BAM highlights the importance of raising awareness about this disease among physicians treating persons showing meningitis-like symptoms. Nature's Spa Treatment has several systems to prevent this in your home. From the simplest and least expensive, our under-counter kitchen or bathroom system, to the most complete and expensive, our whole house water filter system. All our systems may be customized to include such add-ons as UV, reverse osmosis, as well as water softeners. Please go to our website, www.naturespatreatment.com, for pricing on standard units, contact information for pricing on customized units, and as always, free water sample testing. Have your water tested to be safe. Please